Good day, this is the Professor, drwillphd, PhD, for today's Wednesday, August 3rd, 2022. It is 5:48 and 3 seconds, a.m. Eastern Standard Time. And today's research, kidney stones. So let's hop to it here. The diets higher in calcium and potassium may help prevent recurrent symptomatic kidney stones. Date August 1st, 2022. Source, Mayo Clinic. The kidney stones can cause not only excruciating pain, but also associated with chronic kidney disease, osteoporosis, and cardiovascular disease. And if you've ever experienced a kidney stone once, you have a 30% chance of having another kidney stone within 5 years. The changes in diet are often prescribed to prevent recurrent symptomatic kidney stones. However, little research is available regarding dietary changes for those who have one incident of kidney stone formation versus those who have recurrent incidents. The researchers designed a prospective study to investigate the impact of dietary changes, and their findings show that enriching diets with foods high in calcium and potassium may prevent recurrent symptomatic kidney stones. Dietary factors were based on a questionnaire administered to 411 patients who had experienced first-time symptomatic kidney stones and a control group of 384 people. Researchers show that lower dietary calcium and potassium, as well as lower intake of fluids, caffeine, and phytate, are associated with higher odds of experiencing a first-time symptomatic kidney stone. Of the patients who had first-time stone formation, 73 experienced recurrent stones within a median of 4.1 years of follow-up. Further analysis found that lower levels of dietary calcium and potassium predicted reoccurrence. And these dietary findings may have particular importance because recommendations for preventing kidney stones have been based primarily on dietary factors associated with first-time rather than recurrent stone formation. The patients may not be likely to adjust their diet to prevent an incidence of kidney stones, but they are more likely to do so if they can help prevent reoccurrence. Fluid intake of less than 3,400 milliliters per day, or about 9 12-ounce glasses, is associated with first-time stone formation. Along with caffeine intake and phytate, the study finds daily fluid intake includes intake from foods such as fruits and vegetables. Low fluid and caffeine intake can result in low urine volume and increased urine concentration, contributing to stone formation. The phytate is an antioxidant compound found in whole grains, nuts, and other foods that can lead to increased calcium absorption and urinary calcium excretion. By changing your diet to prevent kidney stones can be very difficult, thus knowing the dietary factors that are most important for preventing kidney stone reoccurrence can help patients and providers know what to prioritize. And this is not to say high fluid intake is not important. We just did not find benefits of increasing fluid intake among those patients with a history of kidney stone formation. The study concludes that diets with daily intake of 1,200 milligrams of calcium may help prevent first-time and recurrent kidney stones. While higher potassium intake also is recommended, the researchers do not make a recommendation for daily potassium intake. The study also doesn't recommend an intake level. The researchers say the takeaway is that patients should add more fruits and vegetables that are high in calcium and potassium to their diets. The fruits that are high in potassium include bananas, oranges, grapefruits, cantaloupes, honeydew melons, and apricots. Vegetables include potatoes, mushrooms, peas, cucumbers, and zucchini. This is a professor of microbiology, bioinformatics, and pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have an awesome day.